of the Malpighi Pathology Academy for Veterinarians. And just to remind you that this foundation, born 2 years ago, and promotes education for everyone who is interested in the field of animal pathology and cytopathology. And as Francesco told, for this COVID emergency, the course on fluid cytology that was scheduled for May, unfortunately cannot be held in Florence, but thank you to him, this course has been converted in a live interactive webinar format for you. And to test the technical feasibility of the Zoom platform to use in that occasion, and will be, sorry, I did not silence my cellular. And we decide to connect just for half an hour today, and the next week there will be another brief meeting just to test the use of Zoom and poll everywhere. So Dr. Carrani now will present you 2 or 3 cases on canine lymphoma, and only you can interact with him through the poll. He will explain you how to do. At the end of this brief session, we ask you to inform us about the possibility that you intend to participate to the next event that will be held in May. And we will send you through Facebook, maybe Francesco is very good with Facebook, and or by mail, we will give you the presentation for the new course. You will find all your microphone shut down to avoid interferences, but please use the chat any moment you like for questions, and I will personally refer them to Francesco during the meeting. If you have any problem, I will, you can sign the number of my mobile, so you can directly ask me how to resolve the problems. And it is the 0039 for Italy, and the number is 328 711 9710. I will also write down this number on the chat. Now, please, Francesco Carrani will explain you how to interact with him for the next, I think, 30-40 minutes. Okay, everything is ready for you, Francesco.
Okay, so sorry for the late, about 15 minutes, so we try to recover this problem as soon as possible. So I see many friends from other countries, especially from Poland, and I'm happy to see you again, even if in this sad situation. So briefly, remember to download the application for mobile that is called polyv.com, so you can interact with some slides just in a sort of game, no? So we can play together just to stay happy during this speech. So briefly, just to save time, what is the importance in trying to recognize from a morphological point of view different type of lymphoma? Because for many people, this is not considered important because the therapy is more or less the same. They think that the therapy is more or less the same, but this is not true. Now, we know that we have many different kinds of lymphoma. Many of them needs specific investigation to be recognized, but many of them also are possibly recognized by morphology. And this is absolutely important because such kind of lymphoma has a different and specific therapy that different from the standard approach. So the modern view of approaching lymphoma is based on different sites approach. So for sure, as in every disease, a correct history is mandatory. Then the second step is the clinical examination, because we know that lymphoma has many different clinical presentation. And so, and this is the reason because the symptoms are also always different and generally not specific. The main difference between dog and cats is that in dogs, usually the multicentric forms are the most common. Also, the classical dog that is presented with generalized lymphodenomegaly of external lymph node. But we know that we have also multicentric forms in which all the lymph nodes are involved. In cats, on the other sides, the most common form are the gastrointestinal forms, the alimentary forms, and the multicentric forms with generalized lymphodenomegaly are more rare. So, starting from the clinical presentation, we can see the first most important difference between dogs and cats. So just to understand what is the frequency in which people see lymphodenomegaly, you could start to look at your mobile and try to express your opinion choosing one of these three options. So how often you see lymphodenomegaly in your practice? Once a week, once a month, or almost never? That means at least once a year. Okay, so you can appreciate the bar that represent the frequency. And this is important for me because now I know that I'm talking with people that see lymphodenomegaly not rarely. And this is true because this is a condition that is very common in veterinary medicine. And of course, the epidemiology tells us that we have many differences according to the different country. For example, in Italy, we know that when we see a dog with a generalized lymphodenomegaly, the main differential is between a neoplastic disease, a lymphoma, or some specific infectious disease. In our case, for example, leishmania is one of the diseases in which the differential is considered the most important. Okay, so we have just few people that don't see a generalized lymphodenomegaly, but probably if you consider also internal lymph node, it is possible that such presentation is more frequent than you think. Okay, let's go to see what are the steps that complete the diagnostic approach. We know that lymphoma can present in a dog in different ways. So lymph nodes for sure, but also parenchymal organ like liver or spleen. Lymphoma could be present in the skin alone and not in other organs, or effusion could be the only clinical signs when we have a neoplastic lesion in some body cavity like pleural or peritoneal effusion. So if you remember, according to the different presentation, the collection technique of sample is different. So generally we try to avoid mandibular lymph node because they enlarge very often in case of any disease involving the first respiratory tract or the mouth. Or when you see some organ enlargement like the spleen, for example, or the liver, you need to make a fine needle aspirate using ultrasound. And in case of skin, and I know that in this meeting we have very famous dermatologists that are hearing us, so they can confirm that it depends on the clinical presentation. Sometimes lymphoma presents with diffuse lesion, and in this case, fine needle aspirate cannot be so rewarding like in case of a presentation through a skin nodule. When you have a skin nodule, generally fine needle aspirate allow us to collect many diagnostic cells that are absolutely suggestive of lymphoma. Okay, having said that, actually the modern approach consider a classification that is based on the clinical feature, morphological data coming from both cyto and histology, and then to define the phenotypes. For sure, we need some specific examination like immunocytochemistry or flow cytometry or immunohistochemistry when we have a biopsy available. And finally, PAR. PAR is a recent molecular technique that allows us to identify some clonal proliferation when we have a lymphoid proliferation And we are not sure, basically we are not sure if this lymphoid proliferation is a reactive proliferation or is a clonal neoplastic proliferation. Okay, this is just a brief summary, just to remember why it's so important that morphology for us in veterinary medicine is still an important step. Okay, let's start with cases. So I selected 3 common cases of lymphoma just to highlight some difference and to highlight some situation in which morphology can allow us to recognize the kind of lymphoma. This is the story of a cross-mixed dog of 9 years old with a classical presentation in which all the external lymph nodes are enlarged. And this sample comes from a popliteal lymph node. So let's see some picture. We can describe some picture and then we can comment and we make some question just to see if you are tuned on the same wavelength. As you can see here, we have a population of lymphoid cells. Of course, in this presentation, we consider that people is able to recognize the difference between a reactive lymphadenopathy or a lymphadenitis and a lymphoma. We are treating cases in which we are sure that we have a lymphoma. In this case, we can see a quite monomorphous population of cell, for sure lymphoid, in which we can appreciate very carefully many details, starting from the shape and size of the nucleus, the position of the nucleus, the distribution of chromatin, the presence, number, and shape of nucleoli, the amount of cytoplasm, and finally the color of the cytoplasm that even if it's not specific can be suggestive of some specific feature. If you have some question during the presentation, please feel free to send a message in the chat so the moderator can evaluate your question and decide to stop me and we can talk about your question. Okay, just a few seconds. You can see the question and you can see the picture in the background. So according to the morphology, according to the size of the cell, how you can define the size of the cell, small, medium, or large. Just a few seconds to complete the votation. Okay. When we make some statement like decide the cell size, of course, we refer to the majority of cells because it's very rare that you can see a lymphoma in which all the cells are the precise same size. Very often the cell size is not uniform, so we consider always the majority of the cells. And in this case, I agree with you. The majority of these cells are large cells. And this is the first important step because the 2 big family of tumor are the small cell lymphoma that generally are a small degree, low-grade lymphoma, and the other big group is the large cell lymphoma in which generally we see high-grade lymphoma, medium to high-grade lymphoma. This is another picture in which we can evaluate even the background in which you can see a lot of blue material and in someone, of course, some of these considerations are obvious and are easy for most of you, but we must consider that we have also some cytology beginners in this group. So don't be bored if you spend time to describe, for example, lymphoglandular bodies like this blue one in the background that are simply fragment of the cytoplasm that is broken during the metabolic turnover in the lymph node. And we can even here appreciate the size of the cell. So according to this picture, we can make some consideration about the nucleoli. So what do you think about these nucleoli? Can be defined single, multiple, or the presentation of multiple with some macronucleoli. That could be considered an important feature in evaluating lymphoma. I hope that the stuff on your mobile is working. Unfortunately, just the first 40 people that can vote are accepted. This is a limit for this version of Poll Everywhere. Okay. I agree with the majority of you because this kind of lymphoma shows a different bad pattern of nucleoli. Some cells are multiple nucleoli, and this could be referred, for example, are centroblast-like cells. But many of these cells shows a single big nucleolus. Unfortunately, my pointer is not visible. Okay, now I have, like in this case, you can appreciate here a big central nucleolus. And this is important because this feature identifies a specific family of B cell inside the lymph node. These cells, I remember you, are called medium-sized macronucleolated cells, MMC. And this is quite specific of dogs, even if can be found in other species, but very rarely. And these are not rare in dogs, but rare in many other species. Okay, let's go on. Another picture of the same case. In this case, the picture shows a more compact field of view. And remember that when we have such compact cells, like in this case, could be more difficult to assess the size. So I suggest you to evaluate the cells in field of view that are less thick, less condensed than in this case. But here it's important because here we can evaluate, for example, mitosis. Even if someone said that mitosis in cytology are not so important, when we evaluate lymphomas in cytology, we can consider also the number of the shape. When we consider the number of mitosis, I remember you that usually it's a convention in which that say that generally we must evaluate 5 fields of view at 40 pair magnification. So up to 1 mitosis for 5 fields is considered a low degree. 1 to 2 is medium, 2, 3 or more is considered high. Consider that this picture is took at high power, so in oil immersion. So when we see 2 mitosis in 1 high power field, means that probably at 40 pair, the number of mitosis is absolutely elevated. So in this case, we can consider this number of mitosis according to the size of the cell as an high grade. Okay, let's go on because time is running. Look at this other picture in which we can appreciate the feature that we are talking before. So some cell with a very prominent single central nucleolus and some other cell more larger for sure with multiple nucleoli. These are red cells that we are used always as a measurement unit. No? Remember that the size of the cell is considered small when the cell is more or less 100 cells, medium when it's more or less 2 times the red cells, and 3 or more, the cell is considered large. So according to the clinical presentation and the specific feature that we saw before, what could be the most likely classification? We talk about most likely because we cannot be sure 100%. So it could be an anaplastic, it can be defined as an anaplastic lymphoma or a large cell high grade, or more specific diffuse large B cell lymphoma, mainly immunoblastic. So why so specific definition that is called a DLBCL? Because this kind of tumor has some specific feature. Okay, the majority of you decide to define this tumor like a large cell, high-grade lymphoma, and of course, this is not wrong. because these are large, because for sure the lymphoma is high grade, so it's a good result. Someone tried to push the limit a little bit further and say that is a diffuse large B-cell lymphoma. And definitely I agree with these people, simply because you are able to identify different components of this tumor. This is a specific lymphoma. The old name of this lymphoma was centroblastic polymorphic lymphoma. It is a lymphoma in which we recognize at least 4 different kinds of cells. So centroblastic cell, centroblastic-like, small blastic cell, and the last component is the MMC component, medium-sized macronucleated cells. So this is one of the cases in which we are really not sure for sure, but 90% sure about the kind of tumor. So morphology in this case can avoid to recur to, for example, to more sophisticated and expensive studies like immunophenotyping. But in case that you want to confirm your suspicion, what investigations are indicated in this case? Immunocytochemistry or flow cytometry, lymph node biopsy, or PAR, that is a PCR for molecular study. Okay, the majority choose the first one, and I agree that this is for sure the most reliable, less expensive technique that can tell us if the tumor is a B tumor or a T tumor. But I want to spend a few words about the lymph node biopsy. Architecture of lymphomas many times make the difference. So if you want to know something about the architecture, you need an histological examination. So biopsy or histology of the whole lymph nodes. I have Francesca here that can say something if she wants about the histopathology of the lymph node. What can I tell you? What I can tell you is that biopsy made by TrueCut is not a good examination. It's not a good choice, in my opinion, because all you can get through using a TrueCut is a small fragment of tissue that many times is deformed and is distorted and do not allow us to histopathology to evaluate the architecture and the distribution on the germinal center. So just in case you have a case that is difficult to understand, the suggestion, the best technique is to remove the whole lymph node and send the whole lymph node to histopathology. And finally, PAR. Remember that PAR is a very good examination. It's sophisticated examination, but is more useful to identify the lymphoid proliferation from reactive lymphoid proliferation to neoplastic proliferation. Of course, is less sensitive to, or is not indicated to identify, for example, difference between a T lymphoma or a B lymphoma. So remember to choose the correct technique according to your question, so to your doubt. So if you want to know the phenotype, this is the best one, immunocytochemistry or flow cytometry. What is the difference between the two techniques? Basically, it depends on the possibility to have a lab that is close to you, because to perform flow cytometry, the sample that you send to the lab must be fresh. So we have few hours available to send the sample to the lab, generally no more than 24 hours. So if you have to ship for long distance your sample, absolutely flow cytometry is not indicated. It's better to request immunocytochemistry. And I don't know, Francesca, are you getting some question through the chat or not? Remember that your microphone, okay, I open your
Yes.
microphone.
Can you hear me?
Yes, now I can hear.
No, I have some question from Agatha. She's writing, the last one is, I mean, how do you answer the question on the diagram? Maybe she has problem with the poll system, because the first was, how do you choose options? This was a question from Agatha on when you present the poll, and I told her that then you explain for each question the motivation. But then she's asking, I mean, how do you answer the question on the diagram? Maybe we can ask Agatha to open the microphone and ask directly to you, if you like.
Okay, for sure.
Can you,
Agatha,
hello?
if you like, you can unmute by yourself. So open the microphone, and if you want to explain your technical question.
Ah, she has not the microphone. She has not the microphone. Can you, was a private chat, but I don't understand very well what
Okay.
she means.
So, I'm sorry, but
maybe the next, okay? We will go on with the chat, sorry.
Okay, so the final diagnosis in this case was really a diffuse large B-cell lymphoma. It was confirmed by, by the markers. So this was the tumor CD3 negative and CD20 positive. That means a B origin. Okay, so let's go to the next case, case number 2. Another cross-mix male, 80 years old, and the presentation is a dermatological presentation. Unfortunately, all I know that a skin nodule was sampled, but I don't know exactly if the skin nodule involved just the superficial part or even the subcutaneous, or if in some other part of the animal there are some other skin lesion. So let's go to see what is the cytological presentation of this sample. Just a few seconds to look at the picture. In the background, you can see a little bit of blood, no other cell, but just this population. Okay. And from a cytological point of view, how could you define this better? Remember that in cytology, the first step is trying to identify a pattern that can be suggestive of different group of disease. We are in the skin, and if you take a sample from the skin, could be, for example, an epithelial pattern or a mesenchymal lesion, mesenchymal pattern, or, for example, a round cell presentation. Okay, someone start to write and see, you can see some word appearing on the screen. Seems that most of you agree with the round cell presentation, and round cell presentation in cytology means that we have single element without any junction between cells. So in other words, we have no architecture. And the presence or the absence of an architecture in cytology is another important clue to immediately address for a large group of tumor, as in this case. So probably lymphoid, tumor round cell presentation. Someone had monomorphic, this is another important information. You can see some difference in this population based mainly on the size of the cell. Okay, so everybody agree that this is a round cell presentation. That means that it's not common for a fine needle aspirate of the skin. Another big problem that we can discuss in another session, maybe next time or another time, is the use of terms in cytology. This is a chapter that it's a big problem amongst cytologists, because all we would like to have is a standard nomenclature, that this is not achieved at least. So we have some indication from the college, but we still have still seeing many different ways to call the same things. And this could be a problem, especially when we talk with colleagues. We need to use terms that are well understood by everybody. Okay, so I agree that this is around cell population, so we can skip and go further to the next slide. I don't know, Francesca, if you agree with me that terminology is absolutely important in every field of medicine, but in cytology, in which many interpretations are artistic interpretation, no? So it depends on the fantasy of the cytology and the ability to describe every single detail and every different pattern.
I agree perfectly.
Okay, so let's go to check this picture in which we can see some beautiful image. It's strange how cytologists and even histopathologists use the word beautiful, fantastic, amazing to indicate very bad condition like tumors. This is a sort of paradox, but we like the visual presentation of some disease, like in this case. So in this case, about the cell size, once again, because these are the criteria that we use most. So the shape, the disposition, the color, these are the tools of cytologists. So no doubt about the size of the cell. And the majority immediately responds, indicating that these cells are considered large. Someone say medium. Okay, few seconds again. Okay, so the majority say, and they agree, that these cells are mainly large and with some other feature. Okay, this is another field of the same disease, of course, in which we can observe some clues that can help us in identify this lymphoid proliferation. So look carefully. I will ask you something to indicate some details, some specific feature of this population. For example, there is a nice feature here that can be appreciated that is called the brain-shaped nucleus, in which the nucleus of the cells remind us to the morphology of the brain, no? With all the convoluted part of the brain. So if you look carefully in this picture, could be not difficult to identify. If your pole is active, you can put a pin indicating what you consider to be called brain-shaped nucleus. Okay, is interesting. Is it interesting? So probably this is a feature that is not well known. Okay, someone start to identify the correct cell. Okay. And it's interesting that many pins goes in some cells that are the object of the next slides and the next question. So we have the possibility to describe and to discuss even this other feature. Okay, In this picture, we can try to talk during the rotation. We can see this cell here with this large nucleus in which we can appreciate some sort of indentation, some cleft in the nuclear material here, here, and here that indicate a sort of three-dimensional presentation of this nucleus. Means that this nucleus is really big with a big volume, and the chromatin is distorted because the abundant of the material inside. And this nucleus here is called the brain-shaped nucleus. And it is generally indicative of a specific kind of proliferation in the skin. So let's go see the next slides. We can comment the other cell that many of you indicated here, just to describe and to highlight this other feature that is different from this. The question in this case is to identify a structure that is called in some different way. The common way is called pseudonucleolus, but the correct name is intranuclear cytoplasmic invagination. That means, in other words, that is a sort of fold of the cytoplasm with the cell membrane that goes inside the cells, reach the nucleus, and enter inside the nucleus. So the structure that we appreciate inside the nucleus that appear transparent, like in this case, very well, is a part of the cytoplasm that goes inside the nucleus and form this sort of bleb. This is transparent, this is cytoplasmic material, and of course, to be confirmed, needs to be evaluated on high power field, because to be sure that this is a real intranuclear cytoplasmic invagination, we need to see that this border here has the same consistency of the nuclear membrane here, just to be sure that this is not an artifact. So in this cell, we have another pseudonucleolus, less visible, more difficult to be sure here. It's more easy to recognize in this part. Okay, very good. In veterinary medicine, this feature is not standardized. So that means in human medicine, human cytology, the presence of this structure in some situation is considered pathognomonic for malignancy, especially melanoma and in other tumor. In veterinary medicine, we have no study at the present, to my knowledge, that evaluate the importance of the structure. So we have just some case annotation, some personal experience. And for my personal experience, I found this kind of structure in malignancy in different kind of organ, melanoma, for example, but also, even if rare, in some thyroid malignancy, some thyroid carcinoma, or in lymphoma, like in this case. So evaluating all the features that we saw before, the most likely diagnosis in this case is, so try to put all these differential in a rank. I don't see, okay. Remember that all the diseases that are listed here are not impossible. And I will try to explain why. For sure, this option is not bad. When you are in trouble, you decide, okay, leave my slides in the desk and go fishing. For sure, it could be a solution. Okay, it is really interesting to see how this rank can change second by second, and it is absolutely normal because all these diseases are possible in this case, especially, for example, a poor differentiated plasma cell tumor. Because can you appreciate here this multinucleation? So this disposition, the eccentric nucleus, multinucleation are features that are absolutely not rare in plasma cell tumor. So in this case, a cytological diagnosis, in my opinion, cannot be really definitive. For sure is a diagnosis in which we can put this disease in an order of probability, and more or less I agree with this rank. So the first place for sure, the possibility is the cutaneous lymphoma that is not a common lymphoma, but also histiocytes, because all this cell has some cytologic feature that absolutely can be compatible with histiocytes. Do not forget undifferentiated mast cell tumor that sometimes are really hard to recognize, even if mast cell tumor tend not to have a so eccentric nucleus, but generally they tend to have a more central nucleus. So in my opinion, the most common in this case could be a cutaneous lymphoma, a poor differentiated plasma cell tumor, and histiocytic neoplasia for sure. So let's go to see what's histopathology say about this kind of tumor. So this tumor was defined by histopathology like a cutaneous lymphoma, and the specific epitheliotropic, I don't know exactly if it's true or not. I trust the histopathologists. I know that this kind of differentiation, epitheliotropic versus non-epitheliotropic lymphoma, is possible just by histopathology. Of course, cytology cannot evaluate the distribution of the neoplastic cells between the different layers of the skins. Okay. Francesca, are there some questions, or can I move to the next case?
Go ahead. We do not have questions. Sorry.
And we are lucky that attending to this meeting, we have also the author of this sentence that I took from his book, Canine and Feline Skin Cytology. Is a dear friend of mine. I'm so proud to have a so famous friend. And remember that this diagnosis is very difficult. So made this diagnosis with caution, because from the experience of these dermatologists, we know that sometimes we can have some skin nodule with a true neoplastic presentation with very bad signs of malignancy in the lymphoid cells, but this proliferation spontaneously disappear. So when you are in trouble, when you suspect a cutaneous lymphoma, please make all the correct steps to reach the diagnosis, make histopathologies, and then consider always the clinical presentation as an important way to follow. Okay, so then if you don't have any question, we can move to the next case. And the last one for this day, sorry for the late, we have just 15 minutes. This is a case of a quite old Rottweiler female, in which the clinical presentation is quite typical because just one lymph node is enlarged, and this lymph node is a popliteal lymph node. This is the fine needle aspirate of this case. And that is really different from the previous slides, the previous presentation. So just a few seconds to examine this. I don't want to talk too much here. I don't want to reveal too many details of this disease, but it's quite nice to see. We are always happy when we see something that we can recognize at first sight. Okay, so let's go to see some consideration about this population. Is it correct, in your opinions, to state that this is an homogeneous population of small lymphocytes? What do you think about? You know that the definition, the recognized homogeneous versus heterogeneous population of small lymphocytes is one of the first steps when we try to understand if you have a reactive lymphadenopathies or a neoplastic monomorphous proliferation of neoplastic origin. And this is not always easy. There are many situations in which we are in trouble, and especially because fine needle aspirate do not explore the whole lymph node, but could be just a part of the lymph node. So we can explore maybe a part in which the lymph node is hyperplastic, and in the other part, the population, lymphoid population, is already neoplastic. So this is the importance of make several different fine needle aspirate of different areas, even of the same lymph node, but especially of different lymph nodes. So in this case, the majority say true, and they agree, but I understand why some people say that is not true, that this is not homogeneous, because if you look carefully, you can see that we have different small lymphocytes here, different shape of lymphocyte, and okay, now I have my pointer, especially if you consider this kind of cell here, in which the chromatin is more fine with some aggregation, puntiform aggregation here, and some other lymphoid cells that are smaller with darker chromatin, more condensed chromatin, even if the shape of the cytoplasm is more or less the same. But for sure we are in a lymph node, so finding even few or small lymphocytes, a little bit smaller, cannot change the definition of homogeneity of this population, in which the large majority of lymphoid cells are small lymphocytes. Of course, don't be wrong, do not consider the pink material, these nuclei here, because all of them are naked nuclei, so they are broken cells. And in this case, we tried not to evaluate these cells because these cells do not reflect the normal shape of the cells. They lost the cytoplasm because they are broken, so the nucleus is not more keep under pressure by the cytoplasm, so the nucleus expand itself and increase in size. The chromatin enlarge, appear like reticular chromatin, but this is not a true presentation. Of course, if the whole population is made by naked nuclei, our sample is difficult to interpret and to become diagnostic, but it's always an indication that the fragility of the cells inside the lymph node is increased. And so we can try to take another sample with a more delicate technique to avoid that the cell breaks in this way. Okay, anyway, evaluating this cell, especially the shape of the cell, the shape of these small lymphocytes can be suggestive of a reactive population of small lymphocytes, or simply normal small lymphocytes? Or do you think that we can move a little bit further and say, okay, maybe in this case we are able to differentiate T cell from B cell? You know that generally speaking, we are not able just by morphology to identify T cell from B cell, except some situation. Okay. Some other votes here. Okay, let's go to C. In this case, this is not a normal presentation for reactive lymphocytes. When small lymphocytes generally react, the only change that we can appreciate is a little bit increase in the amount of cytoplasm that generally is basophilic, but not in this particular shape here that you can see, in which we can see this sort of tail of the cytoplasm, like in this case. And this is not considered an artifact, because if you look at the direction of the tails are directed in different way. No? So for sure it's not an artifact due to the smear, but it's a real morphology of the cells. And this kind of morphology is specific for some lymphocytes coming from the T zone of the lymph node. And these are for sure T small lymphocytes. The problem is to be sure that this is a neoplastic proliferation or an hyperplastic proliferation. In this case, all the lymph node, all the lymphoid cells are small T lymphocytes, so-called also hand mirror, because they looks like a hand mirror in which that you can put your hand here and look at your face inside the mirror here. And but be careful because it is not rare to find an hyperplasia of this cell, and that must be absolutely differentiated from the a true lymphoma of the T zone. So if you are in doubt, because this is a low-grade tumor, this is an indolent tumor, there is no hurry to start a therapy. So take your time, check the lymph node, and eventually repeat the examination. And if you are still in doubt, it's better to remove the lymph node and to send to histopathology. But in this case, we are not to be much worried about the situation, because this is an indolent low-grade lymphoma. So according to this is the question: what do you like more in this situation? Consider this like an hyperplasia, is a lymphoma, or could be both. And even the last one is acceptable. If you don't like this poll, simply do not respond. The problem is that many times we have to respond to this question when we are alone at our microscope, and we have to say something to the colleague or to the owner, and we have to take our responsibility just looking at one slide. So we have to share some feelings among cytologists, no? Some frustration when you see some picture and you are not sure about the final diagnosis. Okay, I know the final diagnosis of this case for sure, so I agree that this is a T-zone lymphoma, but believe me, do not be too much sure 100% at the first sights, because unfortunately I had some cases in which we are almost sure that this was a T-zone lymphoma, but the final results was a T-cell hyperplasia. And we discovered this especially when we notice this case in cats. This is not reported to be present, this kind of lymphoma in cats. So once that we discovered some lymphoid pattern in cats with the T-zone lymphocytes proliferation, we simply say, okay, wait, just a moment. Let's go wait and see what's happened. And this situation at the end were T-cell hyperplasia. So probably we must discover other important feature of this kind of proliferation. Meantime, take your time and be sure before to start any kind of therapy, or worst, if you decide to make an euthanasia because we have a lymphoma. Stay on the safe side. So now we are at the end. I try to save some time to the end. So thanks for, I'm very happy that you participate in this. This is time for question. And before the question, just a message, because this period in which this kind of virus spread across the Europe, across the world, allow us to take our time and start to reconsider our relationship with the world, with the nature. And in my opinion, we have to consider that nature is one of the most important things that we have in the world. This is a fox that I meet during one of my walk through the woods. And looking at these beautiful animals, I always remember that we must, I don't know, bring more respect to our world, to save our world. Okay, thank you. Now we have just a few minutes to answer some questions. If we have any feedbacks, any comments is appreciated here or on the Facebook page, because we are trying to improve, and it's possible to continue with this kind of pills, this kind of information, this kind of meet between colleagues, just to keep our friendship very strong.
Francesco,
Mm-hmm.
many of the colleagues are thanking you and saying that it was great, this meeting, very educational. And so I really would like to see other many people the next week for the same kind of small meeting in 20.
Okay, we try to repeat this experience treating 3 different cases of feline lymphomas, and the feline world is always different. It's difficult, but on the same way is so interesting. And my idea, if it is possible, is to continue with some cases, especially nice or unusual cases, not just about lymphoma, about lymph node, but also in general cytology cases. Especially if some company can support us in this spreading with a more professional platform, because this is a sort of artisanal attempt that we made, homemade, just to stay in contact with this colleague. And we are planning to change also the time during the day. Probably many colleagues prefer this kind of meeting in late evening. So we can make a survey, and then we decide if move this kind of meeting in late evening. At the moment, we already scheduled the meeting of the next week that remain on Wednesday and Friday at the same times. But in the future, for sure, we could change.
Okay, so we thanks everyone that was here with us, and thank you to you, Francesco. Fantastic, really. Thank you very much.
For you, to our friends, to Chiara Noli, that was a honored guest of this meeting, and Francesco Albanese, the dear friend of us, and a very, very important person for me, that helped me a lot in many situations. And I hope that I can assist to his meeting very soon on the web.
We are organizing also with Francesco in June.
Okay,
like
in June. We
will inform all the colleagues about the new events.
Okay, fine. Okay, so hello everybody. I'm going to close this meeting, and see you if you like next Wednesday about feline lymphomas. Bye.
Bye.
Bye. Non ancora.
La Polidori?